I'm presenting about empathy in low vision. The aim of this is to make people aware of the words they're using, their actions during consultations, to help patients turn a very negative experience into a more positive, engaging experience.
Bad news is really important because it really impacts on an individual's life, on their sense of self. So we really do need to get it right.
Research shows that whatever happens at that first appointment colours how that patient perceives you as a professional, as well as their entire experience of their vision loss going forward. So if you can turn something very negative into a positive experience, you actually influence how well that patient is able to adjust to their vision loss, as well as how they're going to interact with you as a professional in all future consultations.
When you lose your vision, it is a grieving process, similar to bereavement. So we have to be really mindful of that when we're interacting with patients and give them permission to express those emotions, because if you don't do that, they're not going to adjust to their vision loss and then be able to make the most of life going forward.
Don't belittle people's worries. The patient has genuine concerns, listen to them, respond to them. My pet peeve is when practitioners tell patients there's nothing we can do, because there's always something you can do. It might not be medical therapy, but we can refer people to support networks, to helplines, to charities, to local groups.
You can provide them with low vision aids or advice. You can put them in touch with support services, give them a helpline number, get access to counselling services. You know, there's all these other things are still treatment, they're still helpful. So it's really important that we don't send patients away feeling completely hopeless.
Give people hope. Don't give them false hope, but give patients hope, because without hope, the human spirit just can't survive. A lot of my patients have previously also told me that when they first got their diagnosis, they were talked over, especially if they were given the diagnosis as a child. So the clinician would then speak to the parents or accompanying carers, and the patients get really irritated. So engage with the patient. Even if they can't see you, talk directly to them, because they'll be able to perceive that and understand you better.
And sometimes referring to current research, things that are happening, even if it's not directly relevant to that individual, it just lets them know that people do care, they are working around them. And a lot of this is around making people feel that someone does care.
Be empathetic. Think about how you would feel if you were in that situation. Always ask and engage the patient so that they feel included as part of that consultation.